Welcome back, guys. I hope you are all doing well. So today's my topic of discussion is about the occipital lobe. Okay, so in the previous video, I discussed the mini lobe of the brain, which is the insular lobe, its pathway and related functions. So today's my topic of discussion is occipital lobe. I have to discuss the complete occipital lobe, its association cortex, also the primary visual cortex. Okay, so first I draw the lateral view of the brain and show the occipital lobe. This is our brain. So this is the primary visual cortex of the occipital lobe, which I discussed today, and also this is the visual association cortex of the occipital lobe. These two areas I discussed today. Okay, so I have to draw a more detailed picture. This is parieto-occipital sulcus. This is primary visual cortex. Okay, here is your eyes, and in front of your eyes here is some object, any ball, any pen, any object in the space, any object. I have to draw here a ball which is red in color. Okay, a cricket ball which is red, a little bit orange in color. This is a ball. Okay, this is a object. I tell you how the information travels to the primary visual cortex and what are the functions related to it. Okay, the information you have to receive, you have to see the ball. Okay, but you don't know it is a ball. Okay, guys, please remember my words. This is a ball, but you don't know this is a ball. You just see the image of the thing, of the object. The information goes to the retina in the eyes. Okay, the image go towards the retina in the eyes, and through the optic nerve it travels and cross some of the fiber through the optic chiasma. And here is the thalamus. Posterior to thalamus there is lateral geniculate nucleus. Okay, here is lateral geniculate nucleus. Here it synapse and participate with lateral geniculate nucleus, and then this information enters in the occipital lobe. Okay, in primary visual cortex. So this pathway controls the only see the object. Okay, not recognize, not analyze, not compare with the past memory. No, this area not control this function, only see the object. Okay, what is the object, only see, and don't know how, what is this object. Okay, now the second area, which is just above over here in the occipital lobe, which I draw in blue color, is visual association cortex. Okay, this cortex do, the information which comes from this pathway. Okay, in the retina, in the optic canal. Okay, lateral geniculate nucleus. Okay, and enters in primary visual cortex. This information goes towards the auditory association cortex. No, not auditory association cortex. Auditory association cortex related to what? Your temporal lobe. This is visual association cortex. Okay, primary visual cortex and visual association cortex. These information goes to the uh, visual association cortex. Okay, so what this visual association cortex do? Okay, it do a lot of functions related to this object. Okay, its first function is analyze the object. Okay, its shape, its size, okay, its color, okay, is this object is move or not, okay, all the things, okay, its shape, its size, its color, its movement, okay, all the function done by the second area, okay, which is visual association area. Okay, so when the information take it and one more function performed by visual association cortex, it compares this information with the past memory of the visual stimulus of the same object. You have to heard about this object in the previous history and also the comparison of the previous history. Okay, so I have to not write, I have to just tell you the first is the functions of the visual association cortex. Okay, the color of the object. Second, the size of the object. Third, the shape of the object. Fourth, the movement of the object. Is this object move? And fifth, compare this object with the past memory which stored in the brain. Okay, in the visual association cortex. Okay, so all these functions are related to this visual association cortex. Okay, only the function related to primary visual cortex is just see the object and not recognize. Okay, one just see the object. Okay, through this pathway I tell you in detail. Okay, so what are the importance of this pathway and what are the importance of their functions? uh, uh, there is a clinical importance related to it. Okay, guys, what is the important thing now? Clinical clinical. Okay, when there is damage to this pathway, okay, when there is damage to this pathway, whatever any place, is it in the retina, is in the optic chiasma, is it in the lateral geniculate nucleus, anywhere in the pathway, what are the clinical appearance? The patient cannot see the object. So if the patient cannot see the object, is it visualized or is it recognize the object? No. So there is a lay and the patient cannot see any object. Okay, so if there is this pathway is not damaged, I have to draw in. If this pathway which I draw in black color is not damaged and there is a primary auditory visual cortex, okay, primary visual cortex, which is also not damaged. Okay, so the patient see the object. Okay, when there is damage to the second area, which is visual association cortex, when there is damage to this area, the patient cannot recognize the size, shape, color of the object. Okay, just see the object, just view the object. Okay, and nothing. Okay, and not tell you the information about the object is shape, size, color, movement, not tell. Okay, so what are the clinical term related to this pathology? So what are the clinical term related to it? The clinical term is visual, visual, visual agnosmia. Agnosia. Okay, What are the clinical term related to it? Real agnosia. Okay, what happens in this condition? This is the clinical condition. Okay, what happen in this condition? The patient see the object because the pathway which travels towards the retina, the optic chiasma, the lateral geniculate nucleus, and primary visual cortex is intact, is functional, but there is damage to the second area, which is visual association cortex. So all these functions, shape, size, color, movement, okay, and compare with the past memory, are lost. So the patient develop real agnosia. Okay, real agnosia. Okay, in which patient see the object but cannot recognize the object, not analyze the object, not compare with the past memory. So guys, I hope you understand my video. Please like, share and subscribe, and press the bell icon to receive any new video. And please subscribe and like, and show support, okay, and spread the knowledge. So guys, be happy, take care.